Well, thank you very much, Mr. Chairman. If we're going to safely reopen, public health has to drive decision making. And according to our public health experts, that includes making sure students and staff have access to testing, the ability to safely quarantine if they're exposed to the virus, and support for isolation and access to medical care if they get sick. Students and staff need to be able to participate in their classes while also following public health advice to social distance and wear face masks and keep themselves and their families healthy. But public health experts agree we are not anywhere close right now to meeting adequate levels of testing and
I can't do today, but tomorrow, next week.
Opening.
Yeah, we need to go ahead and get that plan.
Our country.
Now, the other thing is, I don't know about Thursday for him. You need to just check with his people.
Somebody doesn't.
But maybe just check with Rick.
Is everybody else hearing that?
Schedule too. And if we need to, he may be tied up Thursday.
Mr. Chairman, I think
that's the case, we probably ought to just do it.
If the staff could mute him, that would be great. But Dr. Benjamin, let me just direct this to you. If our country remains at current levels of testing, are colleges going to be able to keep students and employees and their communities safe?
Testing has always been the key to success here. We're finally at about 400,000 tests per day. We're not nearly at the 500,000 that we need to be, and every state's a little different. I just looked at a chart today that shows there's a huge variety of states that are not yet there yet. I think it will be a real challenge if we can't get to that bare minimum 500,000 per day. And you may know that several groups like the Rockefeller Foundation believe that we should go to 2 to 3 times that amount per day.
Okay. I've heard it said that COVID-19 is a, quote, great equalizer, but we actually know in terms of the virus's health and economic impacts, nothing could be actually further from the truth, with Black communities and communities of color being at much greater risk of getting sick and dying and of falling behind economically because of the pandemic itself. Colleges determining how to reopen have to consider those inequities in selecting the best course of action for both the students and the staff. So I wanted to ask each of our presidents, maybe in this order, Presidents Daniels, Paxson, and Hampton, how specifically are you each planning to address the alarming health disparities impacting our communities of color as you think about reopening? And I'll start with President Daniels.
One thing that I'm very worried about is that the efforts we've made, and as far as I know, every college and university has made to successfully recruit, and then just as important, see through to successful graduation, low-income, first-generation, and minority students. We've all been making every effort we know how now for some time, and I do worry that these are about to be set back by the tragic factors that you just mentioned. I'm tentatively encouraged that as our deposits have come in, that our URM percentage seems to have held up. I was really worried, Senator, that it might slip back, but maybe not. But I do worry that our progress will be arrested, and that we're going to have, we will certainly pay special attention, again, to identifying those who might be vulnerable. That's mainly faculty and staff, but yes, as Dr. Benjamin pointed out, there are some young people who have these comorbidities that will put them very much in our sights for special attention. And I'm sure you're probably right that minorities may well be disproportionately represented in that group.
They are, yes. Well, President Paxson?
Thank you for the question. And, I've spent my life studying health disparities and economic disparities. And, when I look at it, issues of inequity are one of the major reasons why we should open. Colleges and universities are places that create level playing fields for students. And we can ensure that all students have equal access to education, the quality will be the same, and health services will be the same for all students regardless. So it's one of the major reasons why I want to get students back.
President Hampton?
Yes, Senator Murray, no doubt about it. Race, racism, and health disproportionately impact our institution at Lane College. To overcome these barriers, we need the help of the federal government. Yes, we need your guidelines, but we also need your investment. Our students need your investment. Our students need more monies to attend colleges and universities. Doubling that Pell would help to ameliorate some of those challenges that their families are having right at this very moment as they're losing their jobs, as they're being laid off as a result of COVID-19 and the other impacts of racism. Those students, our students, my students, need an additional investment. Doubling Pell Grant would go a long way to helping them to afford institutional higher learning.
Okay, thank you for bringing that up. In addition to the disparities I just talked about, there is a disparity of resources amongst colleges as well, and we need to address that. So thank you very much for that answer. Thank you, Mr. Chairman.